Generally, if patients have failed medical therapy or very simple solutions to erectile dysfunction, the solutions we have available, and this is about in 40% of patients, they become a lot more invasive, and vacuum pumps, injection therapy, they don't have the best results or patient satisfaction rates. Penile implants have by far the highest patient satisfaction rate. They're the one option that's going to cure your erectile dysfunction. It's a permanent solution. So if you still have interest in continuing on with your sex life and you failed medical therapy, I'm usually going to recommend a penile implant if you want to pursue that route. Really, the main thing that happens during the procedure is we make a small opening between the penis and scrotum, or right above the penis. We get down to the area which is called the corpora cavernosum with a very careful dissection, and we have to measure the implant. This is the most important thing. We measure the implant so it fits your body perfectly. We put the implant in, put a very snug dressing on there to keep from any bleeding or bruising or swelling as best we can, and then you go home and enjoy the rest of your day. Typically for penile implant surgery, there's no hospital stay involved. It's an outpatient procedure and you can go home the same day. Clearances prior to surgery, it really depends on each patient individually, but I would say at the minimum, you're gonna need a medical clearance from your family physician. If you have a lot of cardiac history, which a lot of penile implant patients do, will get clearance from your cardiologist as well. For penile implant surgery, it is important you arrange transportation and somebody to stay with you for 24 hours. You are having a general anesthetic, and we're trying to do this as a minimally invasive procedure, but you have had a general anesthetic, and we usually require someone to stay with you for 24 hours, and no, you absolutely cannot drive yourself home. There's a few things we typically do before a penile implant surgery. One of the things I generally will recommend is using a vacuum pump. And a vacuum pump, we have them at the office here, and they're pre-programmed to help stretch the tissue and fill the tissue with blood prior to the procedure. And that way, sometimes we can get in the largest prosthesis possible at the time of surgery. That's one of the biggest things we do. We go over all your medications with you. We don't want you taking any blood thinners or antiplatelet therapy for a few days prior to the procedure. We usually do not have you shave. We usually do that in the operating room. We do have you do an antibiotic wash prep the night of before the surgery. Medications you're going to want to stop prior to your procedure are any blood thinners or antiplatelet therapy such as Coumadin, Orphan. You want to stop any aspirin. You want to stop any non-steroidal anti-inflammatories like Aleve or Advil. Some beta blockers we don't want you to take. We'll give you a whole list of the medicines we want you to avoid prior to the procedure. Also, fish oil is another one we want you to avoid. Prior to a penile implant surgery, probably the most basic, best information I can give you about eating and drinking is to don't eat or drink anything after midnight the night before. What you need to pack the day prior to the procedure, I would have loose clothing available that's very comfortable. I would use a zip-up top that you can get in and out of very easily. You need a person to drive you, and I wouldn't bring any expensive jewelry to the procedure. I generally don't ask my patients to shave prior to the procedure because it's pretty extensive, and I know exactly what I want done, so I will usually do that in the operating room just prior to the procedure. If you want to help us out and shave around your penis and your lower abdomen, that would be fantastic, but I generally will do that myself. Basically what happens the day of your penile implant surgery is we usually have you come in, well prior to the procedure. We have one of our nurses start your IV, give you some antibiotics in the IV, Our anesthesiologist will come and speak with you and let you know everything about your general anesthetic. The nurses will speak with you. We'll give you something to relax you, take you back to the operating room. You'll have your procedure done. You'll wake up in a recovery room. You're generally going to have an ice pack and a snug dressing over the area where we perform the surgery. And then about 45 minutes to an hour later, we're giving you some liquids and you can go home and enjoy the rest of your day after that. I think when you're the patient, nervousness is very common and it's natural. I'd expect everyone to be nervous. If you're nervous, you can always call our office. You can speak to me. We can answer any questions that you have in front to help calm your nerves. My staff is an excellent resource, and we have patient advocates as well that'll answer questions for you. If you have questions before the surgery, which you most likely will, you can call our office, you can speak with me. My staff is an excellent resource. We've been doing this for a lot of years. You can also call one of our patient advocates as well, and they can give you a more personal perspective on what to expect during the procedure as well.